Hey everyone, this is Joseph Katz with CoverRight. I am here again with CoverRight co-founder Tom Ness. How you doing today, Tom?
Morning, Joseph. Morning, everybody. Doing very well. Thank you.
Excellent, excellent. So we've been covering a variety of topics around Medicare and things people need to consider when signing up. And today I want to just dig into a related topic about the mistakes people might make when they sign up for Medicare, or possibly one of those mistakes is not signing up for Medicare. So Tom,
Yep.
give us two or three examples of some of the mistakes you've seen over time that people have made when
Yeah.
signing up for Medicare.
Yeah. Sure. Thanks, Joseph. And yeah, there are a handful of mistakes, and I'm just going to touch on three mistakes that I know I talk to people about a lot. And the first one is assuming that Medicare, and in particular Medicare Advantage plans, a lot of people assume that they are completely free because they see a lot of TV ads that say, zero premium, like free Medicare plan. When in reality, it's not free. A lot of plans have $0 premiums, which means you don't actually pay anything for those plans per month, but you do still need to pay co-pays and co-insurances when you see a doctor or use other healthcare services. And so it's really important to remember that you're not just getting free health insurance, you do still have to pay, something for it. The second really important thing is that some people can miss what's called their initial enrollment period. So your initial enrollment period is typically the 3 months, before your 65th birthday, and then the month of your birthday, and then 3 months after your 65th birthday. If you miss that window, you can end up with lifelong penalties for not enrolling in Medicare in time. And so we encourage everybody to sign up, and if you're not sure exactly how to do that, you can get in touch with us and we can walk you through the process. Then the third really big mistake is assuming that if you have other healthcare that you don't need to sign up to Medicare at all, which isn't entirely true. If you have other healthcare, as long as it's considered creditable coverage, then you can delay signing up to Medicare, but in some cases you do still need to sign up, even if you have other healthcare from an employer, for example. And you can find out more about that through our ebook and on our website.
So those are just some of the mistakes. I know there's many others that people can make. Obviously, there's cost implications to them, as you mentioned, lifelong costs potentially. Why do you think this happens? Why do you think these people make these mistakes?
I think it's because Medicare is complicated. There's a lot of different parts to it. There's a lot to learn. As more and more people are aging into Medicare, it's becoming more competitive, and so there's more options and more companies offering products. And so there's a lot to think about, and it's really confusing, and people make mistakes because they don't have the help they need.
Regular health insurance is confusing enough. Now you're talking about a government-run program.
Yeah. Right.
What advice do you have for our listeners and for anyone who comes across this video so that they can avoid making those mistakes?
Yeah. So I think the best thing that you can do if you're coming up to that time of signing up to Medicare is speak to a trusted advisor. Find someone who is highly experienced in the industry and who has a track record of helping people, and speak to them as early as you can to learn what you need to do to sign up to the different parts, and to avoid potential late enrollment penalties like we talked about, and also to make sure that you are signing up for the type of additional plan that suits your preferences and needs the best.
Right. Now, previously we talked about how not all plans are created equal, and just because I have an Aetna plan doesn't mean you should have the Aetna plan.
That's right.
And it varies by zip code and age and geography, and there's a lot of nuance. So you mentioned some of these penalties and some of these mistakes. If someone happens to have made a mistake, they realize, okay, I'm 66, I didn't do my initial enrollment period. How could they rectify that? What can people do to fix any of these problems?
Yeah. Good question. So in rare circumstances, you can lodge an appeal with Medicare to have those penalties reviewed and potentially overturned. But obviously, those penalties are there for a reason. So you can't just expect that they will get overturned. And we definitely wouldn't advise people to count on that. Really, the best advice that we can give is to make sure that you are rectifying the problem and signing up for the types of Medicare you need as quickly as you can to pause those penalties that you're accruing while you're still not signed up, because they continue to accrue while you're still not signed up.
So the later you wait, the larger the penalty. Is that?
That's exactly right. The longer you wait, the bigger the lifetime penalty gets.
Wow. So good advice to speak to a trusted advisor, figure out what you need to do it as quickly as possible if you missed your enrollment period, and continue to learn more about the Medicare process. Tom, as always, very enlightening. We do have a book, a guide for folks. We'll make it available in the comments section so that people can download a full book on how to, what these mistakes are, how to avoid them, what they need to know when they're making these choices. Obviously, they could reach out to hello@coverright.com. And Tom, I'm sure you and people from your team would be happy to speak to anyone as those calls come in or those emails come through. So absolutely. I thank you for your time today. And for everyone else, make sure you avoid these mistakes. Have a great day. Thanks for listening, and we'll see you next time.
Thanks, Joseph.